Okay, just, I'm sorry. I'm sorry. I've got her doing like 6 different things. Of course. Take a breath. Oh, hi. I guess we're live. I'm sorry. I didn't realize we were live yet. Welcome back. It's 1:15. Today we're gonna finish up here. We're gonna go through a spreadsheet that we've created, on the budget asks for the departments that we have jurisdiction over, that we've heard for the last 2 days. They're asked in the BAA, and just discuss what our positions are. And I believe that's being posted on our website, as well as we're gonna put it up on our screen here in a minute. So let's,
Do you want me to share?
yeah, do you want to share it? I think you're the only one that can share. Okay.
Because then I can't.
Okay, no, well, take a minute. You sent it to everybody? Oh, and people also have it in their email. in
Yeah,
case.
that's right.
Okay. On that.
Yeah, that's one I have.
Oh, okay.
No, you get that. Would have been. Mm-hmm.
They're in her.
Oh, yeah, I read that.
So while we've got a second, can I?
Yes, of course.
Just to orient everybody, hopefully the table looks familiar if you were here last year. In the left column is the agency which presented this in their BAA to us this week. And the proposal column is just a very short summary of what the item is that they're asking for additional money for. And the amounts, there are 2 listed, the gross amount and then the general fund or the state amount. And then the HHC position is where I'll be tracking and filling it out as we discuss it, but Alyssa will lead us through kind of talking about questions we have and then our feelings about whether we support it or not. And then in the notes column, I've just added a couple notes to kind of remind me of what it is. And again, I did this very quickly over the last half hour. So there are a couple things, like you'll note DMH only has the PNMI line, because that was really the major thing. I think there was another small line item that I'll add as we're talking, but this should include everything else, I think. I'll need help referring to the household insurance survey amount. I couldn't find that.
150,000.
Thank you.
General fund.
Okay, so starting at the top, I think this was the largest discretionary ask. One time, $10 million, general fund. If you recall that originally when they presented, there was 4 million that was in a fund appropriated to substance use disorder organizations. They pulled it from that, added 6, and have it now as a provider stabilization. So just a quick show of hands, how everyone feels, if they're in agreement with this. All right, I see everyone, so I think I'm gonna say that House Healthcare recommends. And I think this note is a good thing to have, and I'll flag that for appropriations, that we just want to ensure that the original intention that still may be appropriated to that. The household insurance survey, it was an additional 150,000, which had originally been appropriated for 400, and they have changed it to 550. That's in the field now. Is everyone in agreement of that? Quick show of hands. Okay. That's unanimous. PNMI caseload and utilization, that was from DMH. If you remember, that was, adolescent, children, adolescent, mental health, residential, and their caseload was higher. So again, that's one where I don't believe we have much say over. Just, it's more than they expected. Everyone in agreement? Oh. Again, unanimous. Same thing with DIVA. Their utilization and caseload was increased for Medicaid. And I think they gave a pretty good explanation of why. And again, remember, Medicaid is an entitlement. So that's a responsibility that we pay that. Anyone, everyone in agreement?
The comment,
Yes.
can we not call it an entitlement?
Oh,
I was thinking it's.
That's the federal language, right?
I guess,
Program.
yeah.
There you go.
Okay, an entitlement program. Like, I want to distinguish between things that are sort of discretionary, that we get the choice to fund, or an entitlement program where it is, we have said we will provide these services to these people, so therefore we must pay for these services.
Yeah, there's a
Okay.
rationale.
Yeah, you're right. I'm
What
sorry.
happens in this?
Entitlement program.
Use of language, yeah.
Okay.
Yes, people.
Okay. Staffing and contracts with Diva. Believe that was the PBM. Am I correct in that?
The AU,
It's health access eligibility and it will do it.
Oh, yes,
AU,
As far as temporary
Yeah.
position.
that's right, to help them finish their backlog of redeterminations. Everyone in favor? Or decreased? Well, increased general fund, decreased gross, for operating expenses, everyone in agreement?
I'm sorry, remind me, Matt, this was number 2, I guess, right?
Has to do with digital.
Oh, that's the
Yeah.
digital service.
That's a digital. service.
Yes, okay, got it.
Let's see, oh, these are required rate changes for, FQHCs and, hospice rates. These must change, they're mandated to change every year. Everyone in favor? Time offsets for, oh, yeah. This is, so we're obviously in favor with receiving the pharmacy rates that we needed, so I'm not even gonna ask you to raise your hand on that. The reconciliation of ACO, that is something that must be done. So I'm gonna say our position is yes. They're getting tired of going up.
What if we just do anyone opposed
Yeah,
and then don't we?
Okay, doing one of those. Cost sharing reductions, anyone opposed? Global payments, that's, moving, additional hospitals onto fixed payments.
need to go to the next page, 6 more.
Oh, it's down. Oh, I'm sorry. Kristen, I'm looking at my own on my computer. Yeah, do you wanna blow it up? A little
I mean,
bit?
increase the
I'm,
size.
I'm following along on my computer.
Not sure. Oh, it's.
It's a screen share.
There you go, thank you.
There you go.
That really.
Anyone opposed to the global payments that 3 months sort of catch up?
Now we're gone.
Yeah, duplicate of the provider stabilization, we'll remove that. Childless new adult
I'm
caseload.
sorry, I went too fast for my brain. What, remind me what
We
that?
already did that. We just had it on here twice. That
Oh,
was
got
the
it.
$10 million provider stabilization. That was the first thing we did.
Sorry.
Childless new adult caseload and utilization changes, that was based upon. I'm sorry, I've totally forgotten what that was.
It was in AHS, global commitment, reductions to need for global general fund match.
That's the pilot program? Is that the pilot program?
But lower than budgeted utilization.
Yeah.
Okay,
Same one for the next line.
same one for the next line, carry forward. No one is anyone opposed? So if we can, our screen really went.
Close it and then, close the document and then read it again. And if you go in the Word, it's in the bottom right hand. Bottom right hand corner, you'll see the slide. Bottom right.
Yeah.
I knew that was coming.
There you go.
Yeah.
Yeah, I did that last time and then.
It's gonna get worse.
So I just have to like reset it just to.
Our staff is doubling of the IT support, thank you.
Full service here.
Yeah, exactly. So we are on the page 3, which is the Act 167 Healthcare Transformation Contract Funding. Is there anyone opposed to this? Can you scroll down? It's at the top of page 3. Okay. No opposed, so we are in favor. Oh, I'm sorry. Woody?
Can you remind me about it again?
This was to contract a contractor to, if I recall, help hospitals jump in. It was Act 167.
There.
Yeah.
So this is to,
This is a pilot program?
no, so this is the second stage of the work from the Act 167, which is
The
the
old-
transformation. And they're having, they've an RFP out to hire a contractor to help them do the work.
Yes.
I hate to say it, but yeah.
Okay, so that's a yes. Hospital global payments, didn't we do that one?
And that to bring the other 6 hospitals.
Yeah, we did.
Yeah.
Yeah, that was the other 5.
Yeah, it's a duplicate.
Okay, that was a duplicate. ADS service, we don't really have any say in that, so I'm gonna say yes. And I think that the ACO settlement is also a duplicate. I think that's all.
Where is the, pageant?
Oh. Planned Parenthood.
We haven't gotten to the not
Where?
that's discretionary. Those were obligated. Oh, you called this discretionary.
Yeah, and Planned Parenthood is not on there yet,
Okay.
but I'll write it in right now if you guys want to discuss them.
We do apologize. We've been trying to do this through lunch.
I don't think any apologies are needed. I think you're amazing.
You're doing well.
Yeah,
Yeah, really well.
and
We're
I
fine.
really want to thank Daisy because I'm not sure she actually
Thank you.
got a lunch.
Oh,
Right here.
Planned Parenthood are also one time.
Yep, and Planned Parenthood was the 100,000, so even though it's not yet on here, is there anyone opposed? Okay. And we did the health survey, yes, we did that one. I'll go back and double check. Is there anything else missing?
I don't think no. It's something else. Too.
Insurance survey.
Get the health insurance.
Oh, we got that.
We got that.
Yeah, that was it.
I think that
There was the
I think that's
SUD, there was the SUD stuff, but we don't weigh in on. That's what Dr. Levine presented, but it's for next.
Oh, yeah, that's right.
Yeah, okay, all right, that's right. Yep, so that's it.
All right, so we will pass this off to appropriations. And thank you,
No.
everybody, for,
Yeah, we're gonna have to, we don't have to have a clean copy of what we're gonna send.
no,
Okay.
I think we should have a straw poll.
oh,
You mean on the whole thing?
Looks like a one-liner to me.
You mean like a finishing statement?
does,
Send on to appropriations, straw poll.
We're not sending a document.
we're not sending in a document.
Whatever your letter is, whatever you sent.
You know what, let's just do a straw poll of, is everyone,
You wanna take down?
Yeah,
oh, yeah, sure,
good
that's right,
point.
because a straw poll
Yeah, that's
is
good. And then they can see our
our hands.
honest reaction.
A straw poll on whether or not the recommendations that we have made, in-house healthcare, that we should send those on to appropriations
For the budget.
for the budget adjustment. All in favor?
Mari's
in the corner.
Do
Mari,
you approve this? I don't know if they can see you on the camera, but Mari's hand was raised.
1100.
Proxies, but I give you my proxy.
We can hear you.
All right.
Yes.
1100.
Yes.
All right, so that's all we really had scheduled this afternoon. And I'm, well, hold on. Everyone is able to use their time however they wish. However, I am assigning homework that I would like people to complete by next week, Thursday.
Okay.
And there is a report from the Green Mountain Care Board on Act 167 and recommendations regarding hospital stabilization. And we will have that emailed to you. Although Leslie has indicated that our copy printer room can print a copy for you. It's how many pages?
144 slides.
144 slides, so
But-
probably about 50
I was
pages.
taking notes. I mean, I was traveling around with things, so
Yeah.
it depends on how you see yourself using it.
Yeah, so I'd just like people to, in the next week, read that, get very familiar with it. And because we are going to be talking next week about that. And I just want to set everybody coming in.
We're gonna get the copy of it all.
If you wish to have a copy, you can go down to the copy room and ask them and they will print one for you.
That's the Green Mountain Care Board Act 167.
So one thing you can do is, Kristen's gonna post it.
Yeah.
If you want a copy of it, copy the link, send it down to Tony in the copy room and say, please print a copy for me, double-sided. And then you just go and pick it up.
Or they'll put it in your box.
You just go down and say, I want a copy of the report, it's gonna be like, what report?
Yeah, no, you have to mail it to
Yeah.
them. Yeah, you have to email them.
Okay.
And so Kristen will post that.
And I was kind of wondering, for those who aren't familiar, yeah, with this, is there any worth thinking about a study group or anyone who needs coaching? We could do, I'm
I
not,
just want people to be familiar with it.
it's a little intimidating, that's all.
It is a little intimidating and we're gonna be having people in next week to talk about it. I just want everybody to have, you know, an indication of what it is, be thinking about questions that you might have. It's great. I mean, you don't have to have all the answers by reading this. But, you know, jot down questions, and there is a part in legislative recommendations, possible so I pay particular attention to that part, since that really pertains to us. And anyways, yeah, light reading over the weekend or in the next hour and
Yeah.
25 minutes. All right?
Thank you for giving us those.
Yes.
It's posted.
Do we have any
So I want-
suggestions
Send it down.
for budget adjustment? I mean, we're happy with it all, or would we like to add anything? I don't have anything personally, but I know that in the past, we have added things to it that we thought were important.
I did not hear from anyone in the committee, or no one has approached me about adding anything to it. And the only thing that I would add in our recommendation is the comment that Daisy had of asking appropriations to ensure that the 4 million that was originally in there for substance use, it's now included in the 10, that is somehow maintained. Or that is the intent, that at least 4 million of that will be used for that. All right, so